Hello and welcome to this first presentation of the fall 2019 season of the Medical History Interest Group. This is a great crowd. Thank you for being here. I'm Mary Roby. I'm the Assistant Director for User Services here at LAPAS. And the Medical History Interest Group presentations are sponsored by the LAPAS Library History Collections and the Department of Bioethics and Interdisciplinary Studies. Thank you all for signing in. If you haven't done so, please do that before you leave today. Refreshments are available over there. You're welcome to them at any time. For your information, save the date. The upcoming presentations are Monday, September 23rd, Ink and Silver, Medicine, Photography, and the Printed Book, 1845 to 1900, with Stephen J. Greenberg, the section head, Rare Books and Early Manuscripts, History of Medical Division, United States National Library of Medicine, and an added event, a coffee brunch the following day, Tuesday, September 24th, 9 to 10 a.m. with Dr. Greenberg. On Monday, October 28th, Eastern North Carolina and the 1918 influenza epidemic with our own archivist, Lane Carpenter. On Monday, November 11th, coca, cacao, and cinchona, Medical Marvels and Curiosities from the Iberian New World with Angela Thompson from the History Department, retired. The other exhibits you'll see all over this floor around us. There's a pop-up exhibit about healthcare in Pitt County right around the corner, and we also have a nice exhibit over there celebrating 50 years of history, LAPAS Library. Right here we have an ongoing permanent exhibit, Scientists and Their Microscopes. I hope you will have time at some point to take a look at these exhibits. Today's presentation is Health and Healthcare in Pitt County, 1946 to 2019, Why and How Race Matters. Our presenter is Thomas Irons, MD, Professor of Pediatrics and Associate Vice Chancellor for Health Sciences. Dr. Irons is a native of Greenville, the oldest son of the late doctors Fred and Maylene Irons. He joined the ECU, now Brody School of Medicine faculty in 1981 and was promoted to the rank of Professor of Pediatrics in 1990. He currently serves as Associate Vice Chancellor for Health Sciences. Here is Tom Irons with Health and Healthcare in Pitt County, 1946 to 2019. Why and How Race Matters.
Thank you. I apologize to everyone that we had to start a little late to get everybody signed in. Thanks to all of you for coming, and for those of you who came from outside the university. I know it was a hike, and once you get in the building, you don't know where the hell you're going. Sorry, that's the first time I've cursed, but will not be the last. Before the end of this, I apologize in advance. My mother would not approve. My father would not approve. My mother would say, "That's all right, honey." This is a lecture that I began putting together about 2 years ago. It's part of a journey that I've made in my personal life. This time frame up here is my lifetime. I was born December 22nd, 1946. And that'll come in to the lecture, enter the lecture at a point. But in order for us to understand something about the way things have happened and the way things are in health and in health care, particularly among African Americans, you have to reach back significantly further than that. I can't get all the way to the Civil War, and heck, I can't get back 400 years, which is really when it all started. But I don't have time for that. I've been told that I had to talk for 40 minutes and no more, which is, for some of you, as you know, is not easy for me. But I'm going to do my best to do it. My disclosures, I have to disclose, so I have nothing to disclose, at least not in front of you. I'd like you to be able to think about, to discuss some of the historical events and attitudes that have influenced the health status of vulnerable populations in Greenville and Pitt County up to now. Identify some of the unique characteristics of the very neighborhoods that occupy the area collectively known as West Greenville, which is right there, and right around us, and yet invisible in so many ways when you're on the campus and you're in the tower, if you will, although I wouldn't ever say we have an ivory tower. I've always thought the Brody building was kind of ugly, but that's another story. I don't think it was originally that way, but it has felt that way to me. Why the residents of this area, in terms of contemporary history, because we're going to have to move all the way back and all the way up, why the residents of this area have historically resisted community improvement when it comes to urban redevelopment, revitalization, whatever you want to call it, understanding how that happened and why. I think, but particularly for those of us who are in health care, understanding why patients question us, don't understand, don't believe, may not believe that we're acting in their best interest. And we don't seem to understand that when we sincerely believe we are. I would argue to you that there's a very good reason for it, and they shouldn't necessarily, at least not right off and right up front. Finally, I'd like you to get, and this doesn't sound like history, and I know, Kimberly, glad to see you. I know it doesn't, but we have to, if we want to do something now, I want you to understand what community engagement is. And to understand its potential and to be able to talk about that and its contributions to population health improvement and individual health as well. I came back to Greenville in 1981. I had been, my journey is you getting ready to have the ultimate in whirlwind trips. After finishing high school in 1964, I went off to college right here in Greenville, right J.H. Rose High School, where my son Tom Irons Jr. went, where my grandson Thomas Grant Irons III went, and I came home. I left this place and I went off to college, and I had 4 years of college, and then I went off to medical. I got married to the love of my life, which was the best thing I ever did, in 1967, before I even graduated from college, and she was a year behind me, but we were in love, and that was that, and it worked for 49 wonderful years. It worked, and it took really well. But I wanted to do something different. I was not happy. I was working in a private practice with a 25% appointment at UNC in Chapel Hill. I felt as if I wasn't touching the population of people that I wanted to touch. Yes, I'm happy to take care of my colleagues' children and my friends' children and others, but I felt like I needed to touch a different population of people. I was born that way. It was built into me, as I'll explain to you later. Secondly, I wanted to teach because I had learned that I was a really good teacher, or thought I was anyway. I did from time to time think very highly of myself. I've kind of let that one go, I hope. I thought that if I was going to really change things, particularly in the educational environment, I wanted to start on a path to institutional leadership. Maybe if I could come to a place like this where the mission was clear, where the mission was to serve, that if I could change priorities by having institutional leadership, that would be, I would have the opportunity to shape the institutional values. I never did get into that major institutional leadership role, and it's turned out to be exactly right for me. I'm really glad, because I wouldn't want Mark Stacy's job right now for anything on this earth. Yeah. And he's my boss and my dear friend. By the late 1990s, this is my world, professional world. I had senior administrative responsibility, not within the school, but as president of an organization called Health East, which is a regional system of medical practices which was developed as a partnership with University Health Services and ECU, and ECU's contribution was half my salary. The idea was that we would operate these medical practices, but by good fortune and maybe a tiny little bit of wisdom, about all the wisdom I had in those days, we had managed to convert the organization into a charitable entity, 501c3 entity, that would focus on sustainable health care across eastern North Carolina, and that the hospital was still paying me for that, at least then. And then I was on a lot of national task forces and boards related to health care and the service of the underserved. And I was traveling around a lot, talking about service learning in schools of medicine and how to develop service learning across academics. And what I was doing really, in fact, was just exactly what this says, traveling around a lot and feeling important. And I was in clinic not nearly as often as I used to be, doing less teaching, and for me, that wasn't working. It was pretty clear that wasn't going to work very well for me. And I tell you, my life was pretty darn good. You know, here we are, standing on the shore of Pamlico, my sweetheart and me, and I'm wearing my John Prine shirt. If anybody in here is a John Prine fan, yeah, there she goes. Helen, yes. You want to go with me? He's coming to DPAC November the 3rd, and my son can't go. And we had a really good life, and then we had this thing happen. I was on a lot of boards here locally, a lot. Habitat, I was on the Boys and Girls Clubs board for 22 years. I was involved in a lot of things, in a leadership role, contributing money, chaired a lot of boards. And I was feeling pretty good about myself, but then this happened. And so on September the 15th, 1999, not far from now on the calendar, let's hope for the best, came Hurricane number 2, Hurricane Floyd, right after Hurricane Dennis, and it bore down on Pitt County and Edgecombe County, North Carolina, something awful, and no flood since then, at least in these counties, has come close to matching that devastating flood. This is September the 18th. That's the Pitt-Greenville Airport over on the left side of your picture there. It's all completely underwater right up to here. And this is a bridge across the Memorial Drive Bridge right across the Tar River that's right up here. The water came in, and we were all extremely surprised. We did not have that much wind here from Hurricane Floyd, but the flood came. And for me, at least, the flood was a big eye-opener, a huge eye-opener, because the cover was off. And what I realized, I happened to volunteer to take responsibility for the care in all the shelters around the county. Some of you couldn't, you remember, Bob? And you couldn't get to them by car. You had to fly on a helicopter to get to them. What I found was, here I am, a pediatrician, busy in my little world, taking care of children and that sort of thing, and trying to get involved in public health, but not really being slapped in the face with the fact that the majority of low-income adults, and a huge percentage of them, minority, underrepresented minority, had no health insurance at all, and population health status was horrible. I looked around at those people in the shelters and thought, my God, this is terrible. We're doing a crappy job of taking care of these people. And I saw not just medical ills, which were there, but it wasn't the mold after the storm that made the difference. That was the problem. They were there already. It was the conditions under which they had been living, the social conditions, the educational conditions, the economic conditions, and our systems were very poorly designed to meet the need. And to be honest with you, and I won't name names at this point, but institutions, major institutions, varied tremendously. From really highly involved with a lot of commitment to almost apathetic. It was astonishing to me how easy it was to drive right on by, or for people who worked in my school of medicine to pack up and move to the beach with their children so they could avoid having to deal with it, because they didn't have much at the beach. You know, stay in their beach cottage and not have to do anything. It was astonishing to me that even was allowed or considered. What I did learn then was something that was going to help me later, and I hope I'll be able to teach you something about that. And that was, if you let people self-organize, if they can get the logistical support they need, the supply chain that they need, they'll get things done. That's important. That's what community engagement depends upon. Secondly, there were groups already around, almost all volunteer, that were feeding people, clothing them, providing them shelter on very modest budgets, and I thought, these people need me, and I need them. Third, where people and institutions could come together and genuinely collaborate and build trust, good things could happen. And this is an epiphany for me. I'd been focusing on institutional change. The thing I needed to change was me. You've seen these. Some of you who lived through all this have seen these photos and flood waters. The look on that woman's face is to me, it's something. She's really feeling the anguish of other folks as she's paddling around. This is actually the apartment at Cypress Glen Retirement Center of my mother and father. My dad had just retired in 1997 at the age of 84. And they'd moved into this independent living apartment, which broke his heart. He didn't want to go there. But 2 years later, it was flooded with 5 feet of water. And anything that we did not get out in the 2 hours between the time we realized it was about to happen and the time the floodwaters came in was lost. So I had it. I knew what I had to do. I'd ignored the call to serve in my own backyard, and this meant I had to put my feet on the ground here in the clinic out amongst our neighbors, and I had a lot to learn. Were we serving the people? I've been asking myself that question since the day I got here, and it got more and more, it got more and more acute in my mind. Are we really serving the people? And I had to say to myself, well, in some ways, yes, certainly, but not nearly as well as we could, and I had to learn. I had a lot more to learn. Now, this is 1999. That's 20 years ago. I was 52 and a half years old at the time. And I figured I better start learning quick. So let's take a little journey because I had to go back in history. Many of you have been part of my tours. I take the medical students, all the entering medical students and all the dental students and others on tours of West Greenville when they first, during their orientation. And it's remarkable, the fun we have, but also the insights that they seem to gain. And I bet you there's not a dental school in this country, medical schools there are not many, but a dental school in this country that takes that level of interest in the low-income people around here, not anywhere. We got something to be proud of. Right, Maggie? Yep. Everybody knows what this is, and those of you who know history know what it was, of course, but nobody on my tour knows what it is. This is where we all go to vote. Did you vote there, Helen?
No, I was Keene first.
Keene, yeah. This is an early voting site behind that as well. But this is Pitt Memorial Hospital, which opened in 1955, and we're going to have to start digging back into history. We're going to go pretty far in the next 10 minutes or so before we move on to the next phase of the talk. This was a picture postcard of the hospital in 1955. What was unique about that hospital? Well, there were a lot of things unique about it, but one of them was that it served everybody. And we'll talk about how that happened. The other thing, however, is that it was absolutely, completely, and fully segregated, and we'll talk about how that happened too. It also is the place where I, in many ways, grew up. My mother started taking us with her in the evening to the hospital when we were little boys, all 3 of us, but I was the oldest, and so when I was 12, she allowed me to go with her into the wards, and that's where my eyes got really opened about separate but equal and what that really meant. Something my mother was not desperate, but was determined to teach me, and so that I would understand it. So here's a little bit of history before that, and then we're going to have to run back in history, then we'll come back up, and it does bounce back and forth, but I promise you it'll make some sense. 46, my parents, my mom a pediatrician, my father a general practitioner, who later would get his boards in family medicine, a charter member of that board. They came to Greenville after he returned from a European theater. He was battalion surgeon for an armored, I keep thinking I should be looking at the camera, Mike, forgive me. But I'm not. For an armored battalion, he had been, he'd been overseas. He went into the European theater on the day after D-Day and stayed there following in a convoy of tanks for the entire combat period in Europe. The state was governed entirely by white men. Since the turn of the century, we'd had Jim Crow laws in effect. This is World War II. It's after World War II. It's exactly the same as it was in 1905. World War II's over. Here come home African Americans to serve their country with distinction. They come home to small towns and cities all over the South, all over the Midwest in this country, and all over the country where they have little or no access to hospital care. And the hospital infrastructure across the country has been neglected, and along comes the so-called Hill-Burton Act, but we have to go back 80 years. So this is whirlwind history. Civil War ends in 1864, 1865 to 70. We've got the 13th, 14th, 15th Amendments. Many, many black congressmen are elected. By the 1870s, this is about how long Reconstruction lasted, about that long. There's at least 1870s, the white paramilitary groups began to become very active around the country, particularly in the South and Midwest, and they were ruthless, absolutely ruthless. In North Carolina and elsewhere, the white supremacists of the day regained control. It was called the redemption movement. Redeem our country from the Negro. Redeem our country. The Redeemers, there had been up prior to this the practice of home rule, county home rule, so that all through the South, if a county was primarily black, it could elect its own officials and make its own decisions about how to run elections. That was all about to end, but it hadn't ended yet. The Redeemers were around, and they were making a lot of noise. In 1894 in North Carolina, Republicans, blacks, and progressive Democrats. Remember who was who. Remember who the white supremacists were. They were the Democrats. The progressive Democrats were the ones who were not white supremacists, or not quite so white supremacists. The Republicans and the blacks and the progressive Democrats came together in North Carolina remarkably. They were called the Fusionists, and they became a very strong presence in this state. And in 1896, the Fusionists regained control of North Carolina. The black turnout was 80%. If we could get that today, a lot of things would be different. And then it all poof happened, explosively happened. 1898, primarily through the vehicle. The primary vehicle was a Raleigh News and Observer. Editor Josephus Daniels. You think of them as the liberal paper now. Well, this is 1898. Fernie, well, I can't say his last name, but he was the architect of this campaign. They literally called it in the paper the white supremacy campaign. At this time, there were red shirts marching all over the state. These were armed paramilitary groups. These are the campaign themes. These are quotes. Crush the party of Negro domination, and black men are raping our women. You heard that for decades after that. But that's when it really blew up. On November, the Democrats won the whole blessed state again. So the Republicans, remember who's who. The Democrats, who were the white supremacists of the time, regained control of the state except for one place, Wilmington, North Carolina. And in Wilmington, the Republicans and the progressive Democrats, the Fusionists, retained control. So, with everybody knowing what they were doing, we'll get back to that kind of thing. Everybody knows what they're doing when they do these things. A very heavily armed Redeemer mob marched down to Wilmington, or drove down, or however they got down to Wilmington, and burned the offices of the black newspaper, killed at least 30 black people, and forced the whole newly elected government to resign en masse. Only the single successful armed insurrection in the entire history of the United States. The mob's leader took over as mayor, and he stayed mayor until 1905. It's really astonishing. You know what my history books when I was a high school student called it? Everybody knows. The Wilmington Race Riots. And there wasn't much said about it. This was the Wilmington Massacre. Can't help it, I'm a little passionate. Boom, everything changes. Not just North Carolina, but I'm talking about North Carolina because the only thing I can speak to with any authority and knowledge. Suffrage amendments. It sort of tickles me to think about suffrage amendments. You think about women's suffrage, women get the right to vote. Well, this was about losing the right to vote. The poll taxes, literacy tests, segregation of every public place, public transportation segregated. Virtually all private places where whites were present were segregated. And it was then not after the Civil War that a Confederate memorial statue popped up in front of every courthouse in many, if not most, counties in North Carolina. The KKK was an extremely powerful force. By then, a highly organized group of white supremacists, and many, many political leaders were in it. And I'll tell you that the lynchings didn't stop then. They continued unabated for decades. If you can go to Central Florida in the 70s and learn about lynchings. Black men were regularly sentenced to death by white juries for the rape of white women, and the state and federal governments turned a blind eye. That was the situation at the onset of World War II. Meanwhile, so we're going to have to go back, you know. I take you back, but we're doing pretty well. This man on the left was born to slaves in Hales Ford, Virginia, 1856. By 1890, he was the most prominent African-American man in this country. He remained so until 1915. What was his name? Booker T. Washington, of course. Booker T. would later, historians would not be kind to Booker T. in not too long, in a few decades after that, or 100 years after that, they would comment on the fact that he didn't fight. He didn't force the issue with the whites and get himself involved politically. What would have happened to him in 1900 if he'd have done that? There's not even any question about it. He'd either be dead or in jail. No question, no question. And this man, I bet you don't know his name. He was born to slaves in Halifax County, North Carolina. He was one of a very small number of black educators who were held in high regard by senior state officials. All of them white supremacists. I mean, this is a time when Governor Aycock was governor, when he was brought here. In 1903, he was appointed as principal of the Greenville Colored Industrial School, and it was named for him in 1942. He would die later that year. He was still principal of that school, and it stood right there. and his name was Charles Montgomery Epps. And meanwhile, way up in Gates County, North Carolina, this twin girls were born to a Methodist preacher and his wife, Meline Harold Grant. That would be my mother's mother. On April the 18th of 1915, just about the time that Booker T. Washington would die. Charles Montgomery Epps was principal of Greenville Colored Industrial School at that same time. 18 hours later, she died. She had had identical twin girls who were thus at significant risk. She died almost surely of a pulmonary embolism, a known complication of twin deliveries. The twins were saved, and I don't have time to tell the story, but many of you have heard it, by an African-American woman who came to the door, well acquainted with and a friend of my mother's mother, and to the door of the house and said, I'm here. Miss Meline came to my room. She was at the foot of my bed in the dark, and she said, please come feed my babies. And she did. And so she got up and got on the mule and rode up and said, I'm here to feed the babies. And they said, Miss Meline is dead. These two girls, despite daunting odds, God forbid if they'd have been black, they would have never had a chance. But despite daunting odds, they graduated from East Carolina Teachers College. They persisted until they were accepted into medical school, and it took some hellacious persistence. They had to fight and fight to get in. They ended up at the Medical College of Virginia, which was finally, when they applied to only schools that would take women, they were allowed to go. They graduated in 1941 alongside my dad, who had married my mother in 1939. They were actually anatomy partners. Yeah, so to speak. Yeah, well, you know, my dad started out dating my mother's twin, and then he and my mom decided they hit it off, and that all worked out just fine in the end. I don't have time for the details. But her twin got TB, during their residency while Dad was off overseas. And she was out for 2 years, and then she had some really tragic heartbreak in the loss of the person she wanted to marry, and she never married, but she just became a part of us. And my parents and my mother's twin graduated from the Medical College of Virginia on June the whatever of 1941, and on December the 7th, Japanese invaded Pearl Harbor. So during my dad's intern year, he knew where he would be. And they stayed behind like the women did with a few old men to run the hospital. This is where they were when at the end of the war when they came back. Here's that same slide again. This is the situation to which they came to Greenville. So now you can put it in a better context. And here I come, December the 22nd, 1946, not in the Pitt Memorial Hospital, but a private hospital located downtown. You can see a picture of it here on Johnson Street, with a small colored ward that sometimes operated in the basement, had no delivery area, no nursery for babies. In fact, it was added in the 30s by the local Kiwanis and a few other people who tried to put together something where they would give money to help pay for the hospital. And again, Roger Camera can give you more details on that than I can. I spent the morning of August the 12th, with Roger Camera and Earl Trevathan. And it was as happy a day as I can remember. Roger's a local Pitt County historian. Along 4 years later comes my youngest brother, Fred, who was born in this hospital, which was open to both races. That's the hospital we're getting back to now. In 1946, the Hill-Burton Act, which allocated federal funds to counties, local share was required. They had to build hospitals that would serve all comers, and it was a model of bipartisan cooperation at the end of World War II. We wouldn't get that now. Nonetheless, it was not all perfect, or as colloquially people would say, it weren't all perfect. In 1950, this hospital opened. It was a fine facility by the standards of the day. It's still sitting right there, and the building's in very good shape. Hill-Burton had a dark side. I only vaguely understood it until recent years when I began to sort through what that all meant. Because I don't think I told you what the Hill-Burton Act, who wrote the Hill-Burton Act, but the two sponsors were Harold Burton of Ohio and Lister, who was a Republican, and Lister Hill of Alabama, who was a Democrat. And Lister Hill's father was a surgeon, hence the name Lister, Joseph Lister, and he was a progressive Democrat. And they wrote this bill because they thought it was atrocious that we didn't have decent hospital care for people, including black people, when they came here. But in the bill, segregation was codified. In that bill, segregation was codified into the law. These hospitals have to be segregated. Separate but equal. We all know what that means. And in every way, separate but equal, just like schools were separate but equal. As I mentioned to you, when I got to be 12 years old, my mother started taking me onto the hospital ward. This was a pivotal moment in my life, and the history is valuable for you to hear, I think, or will be. Once I got into the hospital with my mom and started making rounds with her every night, because as soon as I was old enough to go on the ward, I wanted to go. Yeah, I am genetically a doctor, I think. Can't help it. But there's a reason for this little spot here. But she always started on the colored ward. Always. I want to use all these terms of the time. She always started on the colored ward. She came in the back, we walked straight into the colored ward, and the first day that we got there, she started explaining to me, this is not the same, Tommy. She called everybody by their last name for one thing, and nobody else did, but she called the nurse on the ward by her last name. She said, Ms. So-and-so is too busy to help me do procedures. There's only one nurse for all these children, Tommy. And there's an orderly and a nurse aide here and there, but there's nobody to help take care of these children. I'm going to have you help me. And then she sprung it on me, and today I have to do a spinal puncture on this baby. My mama said this, and so I'm going to say it. I'm going to have to do a spinal puncture on this baby. I mean a spinal tap. And she said, because this baby's got TB meningitis, honey, and we have to do a spinal tap every day so we can lower the pressure until the drugs have time to take effect. And she said, Miss So-and-so doesn't have time to help, so today you're going to learn how to hold a baby for a spinal tap. And I did that day. She handed the baby to me. We walked down the hall. She said, you won't catch it. Don't worry, honey. It's up here, not in the lungs. And we went down. I wasn't scared of anything anyway then. But she took me down. She taught me how to hold the baby exactly right and lean way over the table and bow the baby up in the bow. And she said, now pick up the baby and comfort her. She turned around and opened up that tray just as deftly as you can imagine. The spinal tap tray sitting right there for a little old tiny treatment room. You can just imagine what it was like as compared to the one upstairs for the white people. And she pulled on the gloves, which were always too big for her because the hospital never could get the size 5.5 that she needed. They were 6.5 and hung off the tips of the fingers. Earl Trevathan reminded me about that the other day. And Earl's 95, if you don't know him, and he's a legendary pediatrician in this area. And she proceeded to do the spinal tap on that baby. And I watched in amazement. And she did it so deftly with all this. It was rubber tubing if you had an IV. You have to think about it. All the sterilized equipment, heavy stuff. She popped that needle in so deftly, popped in the glass mount hour to watch the pressure go up to here, turned a little stopcock, and let the fluid drip out into what we then called a test tube until it got down to the right level. Stuck the test tube aside, says, pull that needle out, put the stylus back in, pull the needle out, and said, okay, Tommy, pick up the baby and comfort her. And I did. I got so darn good at that by the time I hit the third year of med school, and somebody asked me if I wanted to do a spinal tap. I said, well, yeah. And I could have closed my eyes and popped that needle in that little girl. But I saw something, and I really realized, number one, that this is unequal. It's not right. And that's what she would say to me. Honey, these are my mama again. Marcia knows my mama's words, but my mama again, honey, this is not right. It's wrong. These are all God's children. And that's exactly how she would say it to me. She taught me. And I suddenly realized that my mama, who could be a pain in the neck as far as I was concerned, was somebody that I wanted to be like. Although I'd be like a woman at that age, but I was proud of her. Before we move on, this happened too, and it's a big historical event. Got 10 more minutes. February 1962, George Simpkins, a black dentist in Greensboro, who was head of the NAACP chapter in the area, sued Moses Cone Hospital, a private institution, but had taken federal dollars under the so-called Hill-Burton Act to construct that hospital, and he was waiting for this, and they refused to admit a patient of his who needed IV antibiotics for a severe tooth abscess because all the colored beds were full and the colored hospital was full, and so he took it to court, and as usual, the district court dismissed the case, but the Fourth Circuit Court of Appeals in November 1963 found for the plaintiff. And now, there's a lot to that story because this is right before the Civil Rights Act, right at the time when JFK, right about the time of assassination. Bobby Kennedy was the Attorney General, and he came down with people from the Office of Civil Rights to help develop the argument in that case. And the court found not only, District U.S. Fourth Circuit is Virginia, North Carolina, found not only that the hospital was liable in the suit, found for the plaintiff, but they bought the argument that segregation clauses in Hill-Burton were unconstitutional. It's exactly the same argument that Thurgood Marshall used in Brown v. Board in 1954. Now, to this day, Hill-Burton is the basis for the requirement that no hospital can receive Medicare and Medicaid if they take federal dollars, and they can't deny care to any minority, and charity care is required and has to be documented. Before the Civil Rights Act was passed, and the Fourth District Court of Appeals had already found that segregation was unconstitutional. That's Moses Cone in 62. I think I had one of those station wagons about like that. Around about 66 or 7, it was green. I get back on the bus because as I take people around and leave to the old hospital and get them into that story, we always we leave there and we always talk to them a little bit about the largest public housing project in this area, which is called Moywood, and it's right there. You ever been in it? I know some of you have, because I know Carol, my wife, went in it all the time when she was a community asthma nurse. They were all completed between 62 and 80. These public housing projects. Kearney Park is another one that's a very large one right over here. Poor families would be relocated into these projects when a neighborhood from various neighborhoods. In this case, we're talking about a very large riverside neighborhood called, by most of its residents, Downtown or Downton, and the other name for it was Shore Drive, and it was right here, right there. And we're going to come back to this, so don't think you're going to learn about this all too quickly. This is, if you live in Greenville, you know what this is, the town common. Beautiful spot. You don't see any houses there, do you? No, and you don't see every house in there. It's a huge piece of property. Every house in there was taken in this urban renewal project later on in the 1960s. But we will get to that. It was anchored by this incredible church, Sycamore Hill Baptist. Everybody in that neighborhood and the surrounding areas went to Sycamore Hill Baptist. They all walked. There were a lot of black families in there that had been in there for 50 years or more. That church goes back to the first decade of the 20th century, Sycamore Hill Baptist. And you know, this is something, for me, this is a kind of shocker that as I think about it now, I just can't believe. Here I've met the girl of my dreams in 1966, taken her out one time, asked her to marry me the second time, and she finally consented about 2 weeks later. And that's the truth. And we got married in 1967. Yeah, Phyllis knew Carol well enough to know. Well, she was hesitant at first because she didn't trust me entirely, but she was in love, and so was I, and we were on top of the world. And the thing that bothers me about it is, they were very active in civil rights and, marching and doing it. Oblivious to what's happening right here and to the people who feel it from a different perspective that we could not have. So to give you, I'm not going to take the time to do this, but if you look at where we are now, our map takes us kind of from, I'm going to have to go over here to show you. This is where we are. Here's Violent. Here's the old hospital, Pitt County government, and here's where we get ready to go, Thomas Foreman Park. Thomas Foreman Park, right there. This is a relief wall built at Thomas Foreman Park under the Obama administration with American Recovery and Reinvestment Act dollars. Beautiful structure, because that place was terrible. It was run down. In fact, Talani, you know that you could drive to the street corner just above this, and there'd be a prostitute if the weather wasn't bad sitting there all the time. What Fifth Street was pretty bad. But this wall represents something, and it represents the location of a school. And now you see where we've come. Greenville Colored Industrial School, ultimately Charles Montgomery Epps School. This structure, which I encourage you to go and see and stand in, represents that school, Charles Montgomery Epps School, which was a high school, we called it, but it actually went 6th grade all the way up. People from all over the county around here sent their children into Greenville to stay with their aunties and uncles in the street across the way from Epps, in the neighborhood across the way from Epps Park, so that they could go to Epps School. And then they'd come back and live with their mama in Falkland in the wintertime. Right, Marcia? And here is a photo of Charles Montgomery Epps in front of the Greenville Colored Industrial School with his faculty in the 1930s. You stand there on that property, you're looking right across the street to a neighborhood, which is a regular neighborhood, but I bet how many of you have ever been in it? 1, 2, 3, 4, 5, 6, 7. Well, I go in it all the time. I know you've been in it. And it's called Epps Park. That's the name. The idea that black people live in a neighborhood that's called West Greenville, and that's where they all, their neighborhoods are all crowded. Most of them are black neighborhoods. They're all live in different neighborhoods. I don't think anybody black knows, has any question about that, but somehow white people, I live in Lindale, I don't live in Greenville, and black people live in West Greenville, you see. Any sense? No sense at all. And right there's my friend Penny McDaniel's house. She's right across the street there. I don't have time to tell you how Penny and I got to know each other, but it's pretty funny. My mama got in the car and drove out to Falkland in the middle of the night one night to deliver Penny because a midwife was having trouble. But we digress, and we don't have time to digress. The neighboring streets, just real close, right off West 5th, one of them's really a nice little street, and the other one's really just about blighted, boarded up all over the place, a really bad area. So the city comes up in 2005, contemporary history now, we're getting close to done. The city planners came up with a revitalization plan for West Green. And Merrill Flood was running that plan, and he's African American, and they weren't getting anywhere. The people of West Green were saying, hell no. Don't you revitalize us. We know what that means. We'll be pushed out further. We'll be pushed across Memorial Drive somewhere else, and you'll gentrify this neighborhood. That's how they felt. I had my eye off that particular ball at the time. I was dreaming up trying to get better health care for rural people and building a community health center, which had been a dream of mine for a long time, certainly since 1999 in the flood, when I saw how bad off everybody was. And then I met this person. This was at her service in January of 2009. Leslie Bass and her colleague Margie Gallagher, showed up in my office one afternoon, and we talked. And I didn't know her, and she didn't know me, but we knew of one another. And she had been engaged in the community for about 2 years, thanks to a forward-thinking dean of the College of Human Ecology who said, when warned, this woman is trouble, look out. She doesn't want to do what you want her to do. And she goes into the community and has the gall to tell us that the community should decide how we spend grant money in their community. Can you imagine? That's academic, that's heresy. But the city planners who were getting nowhere realized that Leslie had something going. I'll call her Leslie because we were dear friends. City planners had recognized that she was respected in the community, and they asked her to help. So she got a chance to help, but what did she know that they didn't know by that time? And and thanks to the wisdom of Carla, Hughes, the Dean of Human Ecology, who said, called Leslie when warned and said, Dr. Bass, tell me what we're doing wrong. And Leslie said, you want me to tell you really? And she said, yes, I do. Every damn thing. Those were her exact words. And then she said, like a true wise woman knows to say, and what must I do? And she said, put me in the community, give me 2 graduate students, put me on the ground for a couple of years. We'll figure out what we can do. Well, this intersects exactly with the failed city effort to revitalize the community, because Leslie knew by then that for the elders of West Greenville, 1967 was yesterday. Yesterday. Because here's that Shore Drive neighborhood that you thought that it was all down on the river and was empty and had all this bad housing, and it did. Had terrible housing down by the water, because that's where all the black people got put. All the poor black people got redlined right into places where it was going to flood if the river flooded. That was the way it was done all over, especially in the South. These are those houses right along that street. These are family homes. They've been homes for generations of people. If you look right there on the corner, you'll see Sycamore Hill Baptist Church sitting right there. And look at Sunday morning at Sycamore Hill. This is taped on somebody's door, photograph taken of somebody on that door. And look at the crowd lined up. Church didn't have a parking lot. Why? Nobody had a car, and they all walked. And there's a sign out here which you can't read, but the sign says, we're going to lose this church if you don't fight. Because that project was going to take it away. And you know, by then, 2 years later, this is Sunday morning at Sycamore Hill in 1967. 2 years later, in October of 1969, this was all that was left. All those people who owned their homes they had their homes bought but got no relocation expenses. All the poor people got moved into housing, public housing, which might be the biggest social engineering disaster in the history of this country. They all got moved into public housing, lost every bit of sense of neighborhood and community that they could have. Pardon that commentary. And that church stood on a corner, no parking lot. The congregation had said, no, we will not sell, because they didn't have to. They refused to sell. They held out. In October of '69, they decided they had to sell, and they had long since had to turn the power off and the lights off. They said, we're going to sell, give us what it's worth, and we'll be out of your hair, and went to the Planning Commission about it. And the Planning Commission came back and said, we're not going to give you that. We're going to give you half of that. We're going to give you $80,000 or 50, whatever it was. And when that occurred, the church said no. They had a place they were meeting, place where United Way is now. It's called the Cupola Building. They had a place where they were meeting, but they said no. And so what do you think happened? The next night, February 1969, the church was firebombed. Firebombing was very common during this era. That was a way to deal with people who were agitating. Jewish Chambers got his house firebombed in Charlotte. Lots of well-known people got their houses firebombed. And here I am. This is, and I'll stop with this, with all the stuff about how this intersects with my life, but a lot of people in this audience are white. And a few of them are as old as me, and some of them are older by a little bit, like my friend Jack here. Here Carol and I are just as happily married as we can be. She's in nursing school. I'm in medical school. We're in Chapel Hill. We were about to find ourselves expecting a surprise. She managed to work as a nurse for about 6 months before Tom Jr. came along, which was all right. That was fine with us, and we were oblivious to everything. In July of 2018, that's this monument that stands where Sycamore Hill is now, or was finally, and it was erected several years back by the congregation. There was nothing there before to remember that church and what it meant to this black community. And finally, after quite a significant political fight, as some of you know all about the political fight, the city did fund a monument at Sycamore Hill. So it's wonderful when I take my students there now, to all my tourists, to go and see this, well, you can't see the construction project, but see the mess that's there now, but to see a vision of what can happen there, to remember that church. Leslie understood something that they didn't, and she contributed something. She couldn't change history, but what she taught me was, you can't change it, but you can work with the people and engage with them and let them lead you through the way to do it right. And she did it, and she contributed. She came to me because the city had offered the old St. Gabriel's Church property to her and said, you take it, let the university own it. And somebody told her, go talk to Tom Irons about that. And so she showed up, and I said, don't do it, whatever you do. I know the building well. It's got a lot of asbestos in it. The university not only can't afford it, but this is not then and not now. You'll be held responsible if it all falls through. You'll be the one who has it hung around your neck. People got a target on you anyway, Leslie. She said, I said, why don't you just let the city hold on to it and own it? And then they can pay for all this restoration, and they can lease it to the city, lease it to the university, and you can be the director. And she bought it, and I don't have time to tell you the story of that first meeting, but we ended up buying a bunch of stuff for her that she needed for the little office she had in West Green, which didn't even have anything but a phone in it, fax machine, and a few other things that day with my budget, which was about to run out the next day. She named it for Lucille W. Gorham, the matriarch of St. Gabriel's Catholic Church in this community, who died, of course, just this year. A lovely human being who was almost exactly the same age as my mother, which means that she was over 100 years old when she died. How do you engage? Well, I won't get into all of that, but I can tell you that history has taught me that you have to actively listen. And the most important thing, and this is what I say to the students, and I always stomp my foot when I do, put your feet on the ground. Don't drive by. Get out of the car and see what you can do and who you can get to know. You commit to sustaining relationships when those challenges arise, and you maintain a posture of service, which this is an Irons thing, on your knees. So this is what operates there now, and we have a lot to be proud of there. And I just picked a few pictures, and I bring you back to the Brody Building again, which, God, I hope we can get a deal in the legislature where we can get the money for a new building, because we desperately need it. If any of you have influence, please use it, because we're in a bad spot. But what's next? None of us knows, but I know I'm very happy. I would say this if you weren't here, Mark. I'm very happy with the leadership of the Division of Health Sciences in the school. I'm very happy with the leader of the university. I couldn't be happier. I believe the commitment to service is genuine, more than I can ever remember it being across campus-wide, despite a major financial crisis. And I think, ever since Carol died, I've always figured that whatever I do, I should do what she would want me to do. You know, people do the WWJD. Well, I do the WWCD. What would Carol do? And sometimes, I did one time. I've made a few mistakes doing that because I've told people what I really thought, because that's what she would do. And some of them have been in politics, and it got me into a little trouble. But that's all right. I think we all have to just keep at it and hold on to one another just as hard as we can. Thank you very much. I'm done. Thank you. Thank you. I apologize for taking so long. Anyway, but thank you so much for being here. I love you one and all. If anybody has a question, I'll be glad to take it. Melissa said that I could, but I know you've got a time frame.
Do we have any questions?
We can be here.
I have a board meeting at 7:30.
We can be here as long.
But other than that, and that's by phone, so I do it from my house.
We do want you, if you did not have a chance, please sign in. That is your fee, is that signature, and it means, and looking at this crowd, this is going to be really good. It means we get the funding to be able to have this, to provide some refreshments and things like that. And thank you very much.
Do we have any questions?
Paul, you got a question? You're just standing up.
Your arithmetic, you were married in 1967. You haven't been married 49 years.
I was married 49 years, but we were married 49 years when she died.
Oh, she died. Okay.
When she died.
The same year.
So we were married the same year. I remember because you have a nursing scholarship too, named for your wife, and so do I.
Thank you, Dr. Irons, for the history and coming to the present. Greenville's still segregated, and I'm wondering what you're seeing every day in the hospitals and the clinics, and considering the number of underinsured and uninsured people.
I work in one way. I'm lucky in the environment I do work in, because the clinical environment I work in is pediatric, and it's Medicaid largely covered. To say that racial prejudice, racial bias does not exist would be foolish. I've made a passion of mine and a project of mine to try to teach every single resident, every single student that's there, how to treat people with dignity and respect. I think that's all that we can do. I'm sure I have personally innate bias. I think you're born with it. If you can't help it. That's what surrounds you all your life. You have to work to overcome it. But I think the most important way to work to overcome it is to always think one thing: everyone deserves the same respect. Or in the words of the famous Dr. Moline, they're all God's children, and God loves them all the same. But the whole thing is respect and dignity. And during times like this, when we're in tremendous trial, in my view, in this country, tremendous trial, and things are as bad as I can remember in a long time. It's really important for all of us to stand up and be counted, to speak, but to speak with kindness and love, and it's the only hope we have. Thank you. Thank you. I know a lot of you have to go, and please do. Don't be. I know you have to go, Helen. You told me. Maggie.
Could you say a little bit about what you see as next? I think your slide before this one said, where do we go from here, or what's next? What do you think is next?
I wish I knew. I wish I had that. I don't know, but I'm going to pick this. I can't sleep at night. I don't watch the news anymore. It upsets me too much. I watch the Explorer Channel on TV and pretend that I'm in Europe with Rick Steves. I read that he smokes weed. I thought that sounded like fun, but teasing. But I have to believe that there will be resurgence here and elsewhere. I have to believe that we can, if we continue to stand up for what's right, not with anger, although I am angry. I can tell you I'm angry. But anger doesn't accomplish anything. It doesn't accomplish anything. All it does is just tear at us from the inside. I believe that we can change things if we stay together and hold hands with one another. And I think we're going to do it. I really think so, Maggie. Look at this. Look how far we've come with the dental school. You know, it looks like a dead blame palace compared to the pediatric clinic, but you came at the right time. I can't begrudge you that because you're wonderful, as you know. But I do feel like we're going to do better here in this place, and that at least we can lead others along. I can't say the national picture, but I have a pretty strong feeling that it will be a rebound into a direction that's more humane. I have hope. When I go to Zambia, it's really depressing. They're economically much worse off, and rife with corruption and all the other things that happen. And I think we've got so many resources. We ought to be able to do better if we stay committed to it. I guess for my money, it's don't quit. Keep at it. I ain't quitting. Keep at it. I think we'd probably better stop. Thank you all very, very much.